Hey you guys, welcome back to another video for Spina Bifida Sundays. For this week's video, I'm going to be talking to you guys about the treatment, the causes, and the prevention of Spina Bifida. So in last week's video, I talked to you guys about what Spina Bifida is, and I also talked about the different types. So if you haven't seen that video yet, I actually recommend that you watch that one first before watching this one, because the information from that video is going to help you understand the information from this video a little better. So I will leave a link to that video down in the description below. And also just another reminder to rock your yellow to show your support for Spina Bifida Awareness Month. So I'm going to kick off this video by talking about the treatment of Spina Bifida. For starters, you guys should know that there is actually no cure for Spina Bifida, and that is because the nerves have already been affected. However, there are different procedures out there that could be done in order to reduce the disability. And these procedures are usually done shortly after the baby is born. The type of procedure that the baby receives depends on what type of Spina Bifida they were born with and how severe it is. So Spina Bifida occulta. This type of Spina Bifida usually doesn't require any treatment, and this is because it is the least severe type. If anything, the doctor will closely monitor the baby to see if there's any signs of spinal cord dysfunction. And if there is, the doctor can just perform a surgery on the baby, and he or she will be okay. With meningocele, the sac of fluid that rests on top of the baby's spine gets removed by surgery and the opening gets closed up, leaving little to no damage behind. With myelomeningocele, the procedure to close up the opening of the baby's back is done immediately after birth. And this is because doctors want to decrease the risk of infection and prevent any more further damage on the exposed nerves and spine. For this procedure, a neurosurgeon will take the exposed part of the spinal cord and the tissue, and he will put it inside the spinal canal in the baby's body. Then he will cover up the opening with skin and muscle. If the opening is too big or too difficult to close up, a plastic surgeon will be brought in to help close it up. Even though there's all these procedures that will help reduce the effects of Spina Bifida, it doesn't stop there. Because Spina Bifida comes with other conditions, people who have it will need the ongoing care of different doctors throughout their lives. And some of these doctors are neurologists, neurosurgeons, urologists, occupational and physical therapists, special education teachers and aides, social workers, and dietitians. And now we move on to the treatment of hydrocephalus. In my last video, I mentioned that 90% of people with Spina Bifida also have hydrocephalus. Just like the treatment of Spina Bifida, the treatment of hydrocephalus also happens shortly after birth. Because of the overproduction of the cerebral spinal fluid, a tube, which is also known as a shunt, is inserted into the ventricles of the person's brain. This shunt is supposed to drain the extra fluid from the person's head into another part of the body. And now I'm going to tell you guys about the 4 different types of shunts. Hey guys, I just wanted to pop in here real quick because I am currently editing the video and I realized that I didn't do a good job at explaining the different types of shunts. So I'm gonna just explain it right here real fast. So every shunt is always inserted into the ventricles of the brain, and each one ends up in a different part of the body. So with the first type, and I will put the name of it right here, that one starts in the ventricles and it ends up in the stomach area. And this is actually the most common type of shunt. Another one is a type that will again start in the ventricles and it will actually end in a vein that's either under the collarbone or in the neck. Another shunt again will start in the ventricles, but it will actually end in the chest and lung area. And then finally, it starts in the ventricles, but it actually ends in the bladder. The shunt is placed into the child from either the edge of the soft spot, the back of the ear, or behind the head. And this shunt stays inside the person's body for the rest of their lives. And it usually needs to be changed several times throughout their lives. And now we're going to talk about the causes of spina bifida. There is actually no known cause of spina bifida, but there are some risk factors that increase your chances of having a baby with spina bifida. The first risk factor of getting spina bifida is if the expecting mother has a family history of neural tube birth defects. So if the mother has a family member who's already had a neural tube defect, or even if the mother has had a baby from a previous pregnancy that also has a neural tube defect, the chances of her having a baby with spina bifida are very high. Increased body temperature is another risk factor. So having long fevers, using saunas or hot tubs during early pregnancy can also increase your chances of getting a baby with spina bifida. Another risk factor is expecting mothers who have diabetes, but specifically when the mother has high blood sugar levels very early during her pregnancy. By managing her blood sugar levels can decrease the risk of spina bifida. Another person who could be at high risk for having a child with spina bifida are women who are medically diagnosed with obesity. The link between obesity and spina bifida is still unknown, but experts think that it could either be because of bad eating habits or because obese women tend to have diabetes. Expecting mothers who have a history of anti-seizure medication also have a high risk for having a child with spina bifida. It is a possibility that these medications can hinder her body's ability to use folic acid. Speaking of folic acid is a vitamin that is very important to the healthy development of a fetus. When the expecting mother doesn't consume enough folic acid, this definitely increases the chances of a baby having spina bifida, or really any neural tube birth defect. While there is no for sure way to prevent spina bifida, taking this extra step during your pregnancy and just during your womanhood in general can definitely increase your chances of a child being born with spina bifida. Women who are planning on having children should be taking folic acid before they get pregnant and during the first 3 months of pregnancy. In fact, women in general who are sexually active are highly recommended to take folic acid just in case of an unplanned pregnancy. And these women are recommended that they take 0.4 milligrams of folic acid every day. Women who either have spina bifida, have had a child with spina bifida, or even have a sibling with spina bifida should definitely be taking their folic acid. In fact, it is recommended that these women take 4.0 milligrams of folic acid 1 to 3 months before getting pregnant and during the first 3 months of being pregnant. Folic acid comes in two forms, in its natural form and in its synthetic form. The natural form of folic acid can be found in plenty of foods, but the synthetic form can be found in the form of a pill. It is highly recommended that women take the synthetic form of folic acid because the body absorbs it better. So there you guys have it. This was the treatment, the causes, and the prevention of spina bifida. So thank you guys so much for watching. Tune in into next week's video where I will give you guys a bunch of fun facts about spina bifida. And you can help me spread awareness about spina bifida by sharing this video with your friends and family. Well, I'm gonna go now. Please don't forget to like, comment, share, and subscribe. Peace out.